Welcome to Real Health with me, Carl Henry. Folks, on today's podcast, we are joined by Martina Blake, National Lead for the HSE Tobacco Free Ireland programme. Vaping is increasingly common, especially and worryingly amongst young people. And while it's often seen as a safer alternative to smoking, there are real concerns around nicotine addiction, lung health, mental well-being and regulation. In this episode, we explore what vaping actually is, how it affects the body, what we know, what we don't know, about the long-term risks and the supports available for people who want to quit. Martina, welcome.
Thank you very much.
I'm looking forward to this topic.
Great.
I think it's really important.
Yeah, I suppose it's a topic that a lot of people are interested in because we've seen a huge growth in the number of both adults and particularly young people who are vaping. And I suppose, I work in Tobacco Free Ireland, so our work is around, reducing smoking prevalence. But the phenomenon of vaping has hampered and stalled our progress in terms of achieving a tobacco-free Ireland. So the HRB, the Health Research Board, did a study a number of years ago and looked at whether or not e-cigarettes were helpful in smoking cessation and what impact they had in terms of smoking initiation. And they found that young people who started to vape were 3 to 5 times more likely to go on to smoke later in life.
Wow.
Yeah. And they obviously looked at the harms versus benefits of e-cigarettes as well. So we looked at them before we made these new clinical guidelines and recommendations around what works in terms of stop smoking care. And some of the studies showed that e-cigarettes were helping some people to quit smoking, but at a population level,